Hey guys, this is Curtis Alexander. I'm a pharmacist, and in today's video I want to talk about Qulipta. Now, Qulipta is a very new medication at the time of this video, and it's coming out in the migraine market. And so that's very promising because over the last few years, there's been more and more products that are coming out to help with migraines, but this kind of fills a different niche, and we'll talk about that. So I just want to hop right into it. So first things first, Qulipta entered the market as a drug that has the ability to prevent episodic migraine in adults only. So let's unpack some things here. There's migraines, there's episodic migraines, and there's chronic migraines. Now, what does that actually mean? Well, let's use our magic 15 number. That means 15 migraine days per month. Anything less than that, basically 14 or less, you're looking at episodic migraines. 15 or more, you're looking at chronic migraines. So that's really where Qulipta fits in, as this episodic migraine. Could you use it for chronic migraines? Probably, but it's not labeled or indicated for that, so the doctor, insurance company may not cover it for chronic migraines. But that's the differentiating factor that you need to know. So it's episodic migraines only, and again, only in adults. The one thing I will say about Qulipta is it acts in the same way as some of the other medications that are available on the market, like Ubrelvy and Nurtec, because it's a CGRP blocker. CGRP is basically something that we see a rise in when somebody has a migraine. So the theory right now is that if we can block this CGRP, then we can have a beneficial effect on migraines. And that is what we found in practical use in people in the marketplace. Okay, Qulipta is also made by the company that also produces Botox, which they use for migraines, Ubrelvy, which is used to treat emergency migraines, not trying to prevent anything. It's used to try to treat a migraine as soon as it hits. And then they also have Qulipta to try to prevent migraines. So they have a lot of products in the marketplace in the migraine market. So what kind of dosing are we looking at? So Qulipta is available in a 10, 30, and a 60 milligram dose, and that's just a once a day dose. Again, we're trying to prevent it. So we're just taking it on a daily basis. Now, a couple things to keep in mind where you would want to be careful if you want to talk to your doctor about getting Qulipta. One of those is, do you have any liver disease, liver function? We really become concerned when it's severe liver disease. If it is severe, you're not going to be able to use Qulipta. The other thing is kidney issues. Even if you have severe kidney disease, you should be able to use Qulipta. Again, you're going to have to check with your doctor, but we're probably going to see a decrease in the dose that we're going to use. So that's something to keep in mind. The other thing that you need to be careful about, I don't see this as being a huge concern, but we have to let people know that Tryptan allergies, so we have a class of drugs that's used to treat emergency migraines that are the triptans, like sumatriptan, rizatriptan, which are Imitrex and Maxalt. Okay, we have those two drugs. Those are the triptans. They're an older class of drugs, but if you had an allergy to them, we would be a little concerned about giving you Qulipta. That's something that you could react to in an allergic fashion as well. Okay, let's talk about side effects. It's actually very well tolerated. Again, it hasn't been out a long time, but based off what we've seen so far, well tolerated. Most common side effect tends to be GI, tends to be stomach, gastrointestinal side effects. So we've got nausea. Roughly 5 to 9% of people can experience nausea, constipation in roughly 6% of people. Drowsiness and fatigue, again, around that 6% mark, and weight loss. I don't know, maybe we'll see it come out as a numerical weight loss drug, although that only happens in 4 to 5% of people. Main takeaway from side effects is probably watch out for stomach stuff. Those tend to be the main things, but overall, it's well tolerated. Now, the kicker here is, How effective is it? How does it work? So there was a study that they did, and they compared a placebo or a sugar pill to people who got all of the doses of Qulipta. So some people got 10, some people got 30, some people got 60, and they looked at how many migraine days they had a month before and after getting that. So what did they find out? Well, first things first, let's set a baseline. Even the people that got the placebo in the study saw a decrease in their number of migraine days. They saw a decrease of 2.5 migraine days per month. Now, how could that happen? Because these people know they're in a study. They don't know if they're getting the actual medication, but they know they're in a study. So the brain does have an effect on if they feel there's a migraine coming on. So that does matter. So even though they didn't get anything, the placebo did see a decrease in monthly migraine days of 2.5 days. Excuse me. The people on the 10 milligram dose saw a decrease in 3.7 migraine days per month. The 30 milligram dose saw a decrease in I think I said 3.9. So 3.7 in the 10 milligram. 30 milligrams saw 3.9 days, a decrease of 3.9 days per month. And the 60 milligrams saw a decrease in 4.2 days per month. So your overall benefit that we're kind of looking at is anywhere from a decrease of 1.2 to 1.7 migraine days per month. Okay, and that kind of leads to my takeaway, my recommendation. If you were my mom or my dad, would I recommend it for you? Well, what I would say is you have to look at this. You're going to have to look at, will it help you? Yes, it does appear to help people. Is it worthwhile? Depends on your insurance. Depends on what it's going to cost you. I can't answer that for you, but that would be the first thing I would encourage you to take away, is that you're looking at 1 to maybe 2 fewer migraine days per month. Only you can decide if that's worth it for you. But overall, do I think Qulipta is worthwhile? Yeah, it appears to be pretty safe. It appears to provide some benefit. What it comes down to the end of the day is what it's probably going to cost you. So again, I hope this video was helpful. If you have other video topics that you'd like me to cover, put them in the comments. I try to read all the comments. I can't promise that I'll respond to all of them. I'm getting more and more as I do more of these videos, so it's hard for me to respond to all of them. But don't be afraid to give me ideas. Subscribe, like. What I'd also want to point out is I have a free 30 days to health report. If you're tired of drugs, if you're tired of surgery, you want other options, those are some of the things I cover in the 30 days to health, including some of the things you can do to decrease the number of migraines that you're getting naturally. So again, I cover some of those things. It's curtis-alexander.com. It's free. Just go sign up and I'll send that over to you. So at any rate, I hope this video was helpful, and we'll see you in the next video. Thanks.